Hello, and welcome to the Millennial Nutritionist Podcast. I'm Isla Garcia, master's degree of nutrition science and registered dietitian, and I'm going to make weight loss realistic, sustainable, and uncomplicated for your busy lifestyle. On this podcast, me and my team of registered dietitians will decipher the latest nutrition research, dissect fad diets, and discuss social media trends for you so you can feel confident knowing what to eat to achieve your health goals. Research suggests that most weight loss programs aren't successful, but my experience has taught me that this is not because the participants aren't committed. It's because those diets are designed by non-nutrition professionals and center around severe restrictions. We are here to provide the facts about the science of weight loss so you can have the success you want and continue living your best life. Welcome back to the Millennial Nutritionist Podcast. It's Isla, your CEO, founder, and host of our wonderful podcast here. I have an exciting guest that I met out at an event, and I was like, I have to have her on because we had such a good conversation. Dr. Corrie Maguire, she is a physical therapist, and we met at a women's networking event. Everybody knows I just moved to Texas, so I'm just trying to go to a bunch of stuff to meet people, and we had a really great conversation all about how nutrition really interacted with pelvic floor therapy. And I think that she's a great resource to kind of tap into for a lot of people who are thinking about becoming pregnant, which I know a lot of our audience is, or maybe struggling after pregnancy. So thank you so much for joining us today, Corrie.
Thank you. I'm so excited. We did have such a great chat and really connected at that event because I love when my patients are also working with dietitians and nutritionists. It makes a huge difference in their healing, and it's just awesome.
Yeah, and I think it's such a great topic to talk about because I don't feel like a whole lot of people know about it. And I found a really interesting article we'll go over at the end that even celebrities really struggle with this issue. So I think it's awesome just to kind of talk about it so everybody knows. But let's just go ahead and get into it. So give a little intro for yourself. What do you do? Where, what's your education? So people kind of know how you're accredited to talk about these things. Where do you live? What do you do for fun? All the things.
All the things. So, like you said, I'm Dr. Corrie Maguire. I work at our Fort Worth location at Genesis PT and Wellness, but we're spread all over the DFW Metroplex. And so to become a PT, you go get your bachelor's and kind of whatever. I did mine in kinesiology and a minor in social sciences. And then I got my doctorate in physical therapy. And then I dove into pelvic health as my specialty. So after you graduate and feel like you're finally done with school, you go take a bunch more specialty classes to learn how to treat this specific stuff that we kind of learn a little bit about in school, but we don't really learn how to test it, how to treat it, all that sort of stuff. So definitely not your typical PT. What pelvic health specialists do is we treat everything urinary, bowel, and sexual function. And then we also specialize a lot with the prenatal and postpartum population because your pelvic health is super important during pregnancy, and recovering postpartum is a whole ordeal. The whole bounce back culture, all that sort of stuff just grinds my gears because it's literally so hard on the body to have a baby. And so we help a lot of women through that big physical transition. And so, yeah, this is my passion. I love it a lot. So
That's so cool. How did you know you wanted to do it when you were in school, or how'd you even hear about it?
So in school, I was in the Interprofessional Women's Health Organization, and that's where I learned that PTs could also specialize in women's health. And then when I became a pelvic health specialist, that's when I learned that men also benefit from this too. So I do treat men and women, and one of my personal favorites is bowel and IBS type problems because that was a lifelong struggle for me in high school and especially in college. PT school made it 10 times worse. And so becoming just because stress, you're literally dying when you're in grad school. And so learning about pelvic PT and just the small behavioral changes we go over with so many of our patients are literally life-changing for that sort of stuff. The chronic constipation, bloating, all of those sort of things are things we treat. Because I had tried changing my diet so many times and it would get better and it would get worse. And so that's really where pelvic health can help with that stuff. So that was for me. What kind of drew me to it. And then I also personally had like ovarian cysts, which can be really painful and are super common. And most women are just told like, oh, there's nothing you can really do about that. Because you can't prevent them, like you kind of either get them or you don't, but you can totally manage the symptoms. They can be extremely pain-free. But if you don't know how to do that, they can be so painful. You have nausea, fainting, vomiting, all that sort of stuff. So pelvic health is just kind of this world where like all the sort of stuff that other doctors are like, oh, there's nothing you can do for that. We're like, well, actually, there's a lot you can do. So that's something I love about it too, is the patients in my office are usually so relieved to find someone that can like help with those things. You don't have to suffer anymore. So it's just super fun. I love it.
Yeah, I think that's so interesting. I think we always, I guess I just like associate PTs with like a old lady that like fell and broke her hip, or stuff like that. But we forget like muscles are all over your body. It's like what helps everything
Mhm.
move. So it makes so much sense if like you are treating anything that has like, I feel like discomfort with bowels or anything like that. Like medicinally, it also I think is worth like looking at the muscles, which is really it like makes total sense, but I guess we just all neglect
Yeah.
it. I don't know why.
I don't know either. So I have my pelvis. I know no one can see this on the
Yeah, no,
podcast.
that's good.
Watching, there's so many muscles inside of your pelvis. So that's what pelvic health specifically learns about that most other providers really don't. Like most other providers know that they're there, but don't really learn how to like assess for if the problem is coming from those muscles.
Mhm.
And so like exactly to your point, anything you're treating medically, there's also a physical component. And so like that's what we're going to look at. So it just makes a huge, huge difference because especially if you have a chronic issue, anytime you have chronic pain, you typically also have muscular dysfunction that's going to grow with that because your body tries to protect you from pain. So we have just this totally normal reflex where we withdraw from pain, right? If you touch something hot, you pull away. Our body can do that anywhere, anytime, and especially if we're having chronic pain. So with a lot of my like IBS patients, I have them working with a dietitian to figure out what is going on with their gut that's like happening there. But sometimes they're like, I everything is good now. Like I should be fine. And they're still having a lot of bloating and a lot of pain. And it's because at that point the muscles have just gotten like dysfunctional enough that even when their gut is fine, they're still not having a good time. They're still suffering.
Wow. Okay. Yeah, that's super interesting. I think I have a couple of follow-up questions about that we'll kind of put in here that I'm thinking about. But let's go ahead and just like talk about what pelvic floor PT is because I don't feel like a lot of people even know what that is. So like how would you define it? Like what is the pelvic floor? What is all that stuff?
Sure. So the pelvic floor is a group of muscles that extend from your pubic bone, so kind of right in the very front, to your tailbone, to the two bones you sit on the sides. So it's kind of like a diamond shaped opening in your pelvis that is everything in there is kind of held up and supported by the pelvic floor muscles.
Hmm.
And so it's super important to hold everything in our body up.
Hmm.
And it's just important for all kinds of functions. So they manage bowel function, bladder function, sexual function, like I said, and then also like athletic function. So they're super active during walking, running, jumping, all that good stuff. They also contribute to lymphatic function, which can also help with our digestion and things like that too. So that's kind of what they do. And
Hmm.
then they're also affected by things like stress, diet, and hormones specifically. So, especially during pregnancy, these muscles go through a lot of change because they have to separate, not separate, but like relax and stretch to allow that movement in the pelvis that's not typical when you're not pregnant. So, and then
Okay.
during pregnancy, they have to stretch enough to let the baby out at the end when you give birth, too. So, we work on that a lot as well. The biggest difference if you go to a pelvic PT than any other PT is that we are trained in internal exams. So we are going to do, if you're comfortable with it, you never have to consent to an internal exam or do one if you'd rather not. But we are trained to do an internal vaginal or rectal exam and figure out what these muscles are actually doing. Because we can only kind of give it our best guess purely from the outside. Really, the only way to truly like kind of diagnose what's actually going on is to check inside. So you won't get that, nor should you get that at any other PT.
Do you feel like you're tired of trying every new diet out there whenever you're ready to lose weight, but you never really find long-term success because it's either too restrictive or just not conducive to your lifestyle? Well, then let me tell you about our 3-month lifestyle reset program. This is an individualized weight loss approach where you'll be going through our proven 6-step method and you'll be led by a registered dietitian. By becoming a client of the program, you'll be able to learn how to control your weight, increase your energy and confidence, and also improve your overall well-being. Not to be dramatic, but a lot of clients tell us that they actually change their lives by going through the program and finally find a sustainable weight loss solution when they actually haven't found that with any other program. If you are interested in becoming a client, sign up for a discovery call on our website, themillennialnutritionist.com, with me, Isla Garcia, and I'll help match you with one of our registered dietitian coaches based off of your challenges and their nutrition expertise. If you're ready to find a sustainable weight loss solution in a non-judgmental and encouraging environment, I hope you'll connect with us soon. I think a lot of people forget that there's like muscles all over your body, like I was saying, not just like on the outside, because I think we think of like biceps and like quads,
Yeah.
but like on the inside, there's muscles too. And is that what you're saying, the pelvic floors, or they're also like on the outside?
So the pelvic floor specifically kind of refers to just the ones internally.
Mm-hmm.
So there's like the levator ani is this group of 3 muscles that wrap around from the pubic bone to the tailbone on both sides. They're kind of in a horseshoe shape.
Mm-hmm.
And then kind of the honorary pelvic floor muscles are the ones that those attach to. So that's like your obturator internus, and then your piriformis crosses through there, which usually when I talk about these muscles, piriformis is the only one anyone's ever
Yeah,
heard
sounds
of.
familiar.
Yeah. So those are all strictly inside your pelvis. The obturator wraps around your femur, so it's also kind of outside. But yes, and then the other muscles on the outside, like you're referring to, like the quads, the glutes, the hamstrings, they all attach to your pelvis as well and affect your pelvis as well. But they're not specifically your pelvic floor. But we're gonna check those too, make sure everything's good.
Okay. Well, how would somebody know if they needed pelvic floor therapy? Like, what are some things where like maybe are normalized that really shouldn't be normalized that would mean that like you need some help in this area?
So some pretty serious red flags that this area needs attention is if you're leaking urine at all.
Mm,
So we've super normalized leaking in our culture, particularly for women, with so many activities, and it's literally never normal. I shouldn't say that because very briefly after birth, the muscles are just so stretched that leaking isn't concerning. But even after birth, you really shouldn't be leaking anymore by 6 weeks
mm,
postpartum.
mm-hmm.
So that's literally the only exception to that rule. It doesn't matter how heavy you're lifting or how high you're jumping or if your bladder's full or not. If you're leaking, that's not normal. And then constipation is a huge one that we've also kind of normalized. Like a lot of people think as long as you're going like every 2 or 3 days, things are fine. But really, like if you're not having a healthy bowel movement at least once every day or maybe every other day, depending on what's going on, it's very possible that your pelvic floor is at the very least not happy. And so that's a huge contributor to constipation. And then pain with sex is also never normal. So pain is always a sign that our body's trying to tell us something. How much pain you're in doesn't always directly correlate to how bad the problem you're having is, but it is always a sign that your body wants you to give some attention somewhere. So pain with sex is literally never normal as well. I'd
Gotcha.
say those are the big 3. And then there's lots of other little ones, but those are a good start.
Okay. And then with the GI things, I always have to like talk about like poop all the time with my clients too. It's so normal. Like, do you mean, because I feel like it can go either way. So is it if somebody is like GI is in like they're constipated or GI is in like loose bowel movements, or is it both?
It can be both. So constipation is super common with tension in the pelvic floor because even like I said, even if your gut is totally doing its best, you can just literally get stopped up because your pelvic floor isn't lengthening or relaxing enough to open up and let things pass through. And so people often get constipated due to that or because they're having pain with bowel movements. So they're only relaxing a little bit and still not everything's getting through. Or we also kind of call it functional constipation when you're that person who's flip-flopping between constipation, diarrhea. So like things are literally only coming out as those little rabbit pellets or pure liquid, because that's all that can really get through when you have tension in the pelvic floor. So step one with that is always like more water. A squatty potty makes a huge difference. And then your dietary stuff like your fiber, magnesium, those sorts of things. But if your pelvic floor is tight, sometimes you can be doing everything right. And sometimes it's not even just the muscles are tight. Like I mentioned, it all connects to the tailbone. So a lot of my IBS patients have a history of a fall onto the tailbone. And if your tailbone is stuck kind of in flexion or pointed forward, it's really hard for your muscles to lengthen and relax all the way, because that's their connection point that should be moving with them. And if it doesn't move, they really can't get any longer and more relaxed. So I see a lot of people who have been like horseback riders, gymnasts, dancers, all those sorts of folks that you just like fall in. Um, and that can be kind of like the crux of the issue is we get that moving well and they're like, oh my gosh, I can poop again.
Yeah. I was gonna ask how it manifests from, like, the constipation part. It sounds like, are you saying, like, normally it is, like, an injury or, like, how do you get to that point your muscles are, like, causing you to have, like, GI distress?
I would say that an injury is quite common. What's kind of funny about the body is everything's connected. So sometimes it's not a pelvis or a tailbone injury. Sometimes it's like an ankle or a hip injury.
Mhm.
But since the pelvic floor is so crucial in any of those movements, it'll also tighten up and stabilize internally as well as externally on that same side, because you're, limping or
Mhm.
whatever, using crutches or whatever. And so sometimes you can get a lot of pelvic floor tension just from having an injury elsewhere. And then stress is a huge, huge one. So not to get too sciencey, but the pelvic floor, just like your digestive system, is also innervated by like your sympathetic and your parasympathetic system. So if you're stuck in that like fight or flight feeling a lot, that sympathetic system a lot, your pelvic floor stays tight during that whole time. And so a lot of times people can't just turn that on and off. So you try to go to the bathroom, you're trying to relax, and it just like won't. So we work on that too with a lot of our patients, like relaxing not just your pelvic floor, but your whole body, because that's really kind of like a top down thing that's also going to affect your digestion too. Um, and then also people who sit all day. Sometimes you don't have to have like an injury where you like fell so hard that you couldn't sit or your tailbone is painful. But if you sit all day and out or drive long, long hours, sometimes your tailbone just gets kind of stuck. Your pelvic floor gets kind of stuck in a shortened position because it's just never lengthening. So the body is super efficient. If it doesn't need to do something, it usually doesn't. If it doesn't need to do it often, it'll kind of be like, well, I don't need that ability. So it's kind of like use it or lose it. Or if you can't empty your bladder all the way, like if you feel like you go and you really need to go and like little drops come out, or you are going all of the time.
Gotcha. So then tell us, what does treatment for these things look like? Since I feel like just such a foreign thing that a lot of people don't either talk
Yeah.
about or we don't know about. Like, what does it look like when you have these problems like on your end? What does treatment look like?
Yeah, so we do a really lengthy interview where we talk about a lot of like behaviors. So a lot of times people think they're going to get in here, we're just going to like massage them or stretch them or give them exercises. And we're going to do all of those things too. But specifically for pelvic health, it's a lot of education on what is and isn't normal, because there's so many misconceptions in our culture. So we talk about not pushing when you peer poop, which is really not good for those systems. And tons of people were literally taught to do that when they're getting potty trained as a kiddo.
Yeah.
And then how much are you actually peeing? And are you emptying your bladder all the way? Are you relaxing? Those sorts of things.
Hmm.
And then the assessment is actually going to be like a full body orthopedic assessment. So we're going to look at your back, your stomach, your ability to contract and relax your abs, your hip mobility, all of that sort of stuff, and just kind of see what else might be contributing. Like I mentioned before, a lot of times foot problems cause pelvic floor problems. So I can give you the best pelvic floor exercise in the world. And then if you're walking around like janky all day, it's just the problem's just going to keep coming back.
Mm-hmm.
And sometimes that manifests as pain, but sometimes it manifests as constipation. Like it just depends how your body kind of sends you that message.
Mm-hmm.
So it's a full body orthopedic assessment and then a breathing assessment too, because that really affects your pelvic floor and your digestive system. And then we will do an internal exam, like I said, if people consent to it. And then just like we do externally, like if you ever got PT for anything else, we're going to look at movement, strength, tenderness to touch and pain, how your skin is moving. If you have a scar, like if you've given birth vaginally or via C-section, we're going to check the mobility of your scar. And then depending on what comes up for you, we'll kind of come up with an at-home treatment plan. So give you some homework to do between visits and then work on the things that are going to be like what we do. So I personally do a lot of like dry needling, which is similar to acupuncture, but different. So I'm not going to ask anyone to stick a needle in themselves when they go home. So I'll just do that here and work on those muscles here and work on a lot of coordination stuff. So we do a lot of exercises with breathing, moving, getting better positions, more mobility, for whatever it is you're trying to do, whether that's have a bowel movement, have sex, do a deadlift, any of the above. We're gonna kind of see how those muscles are moving and how much control you have over them. Because our pelvic floor is designed to be kind of operating in the background. So if it's doing its job, you never think about it, right?
Mm-hmm.
It's kind of just like your diaphragm. Like you don't have to think about breathing.
Mm-hmm.
But oftentimes when things are malfunctioning, people are like, I don't even know how to tell you like what it is or isn't doing when I'm trying to do, my stuff. And so a lot of that, checking that and teaching people about just how to control it or what is or isn't helping them get the best like function from that body part. So it really
Gotcha.
varies so much. I can't be like, this is exactly what'll happen.
Yeah, no, that's totally fine. I just want to, I think because it's again just so foreign to think about like how you work out these like muscles that are internally
Yeah.
that it's like feels like we can't really like move like your arm.
Mhm.
But it sounds like a combination. Like there are some things that like a person would go home doing, and then
Yeah.
some things you do in the office. It sounds like are you saying like relieve pain or what is the difference there between like what you can do on your own and what you can't like need somebody in like a physical therapist in the office to do?
Yeah, I would say, especially for pelvic health, so much of it is like education because pelvic health, we're really fortunate. We do have a lot of like tools. So for a lot of my patients, I am trying to get them to be as comfortable and independent with kind of working on these things on their own to where it's not like, oh, every time you have a little bit of discomfort, you have to come right back here. Like,
Right.
I'm going to set you off on the best track and work with you until you're pain free. And so in the office, we're going to go over like all the exercises that would benefit you. A lot of times in the beginning, it's just like, it's honestly a lot of yoga stuff, like stretches with connecting with your pelvic floor. So a lot of happy baby, a lot of like thread the needle, which is like a rotational exercise, things like that to just get muscles moving better.
Mhm.
And then, like I said, the water, the squatty potty, all that other stuff is your homework too. And a lot of times I write this all down for people at the first one because I'm like, I know this is a lot. And then in the office, we're going to physically work on you. So, like I said, we'll do like dry needling, we'll do normal joint mobilization, like you get in another PT's office. So, whether that's like your hips or your back or whatever. Sometimes K-taping. I use a lot of K-tape. If people are familiar with that, a lot of times you see like Olympians wearing it. But there's different ways to tape to improve like the lymphatic mobility and decrease pain and sensitivity. So I do that for all kinds of things, but also for my people with like constipation, bloating, like K-taping for bloating is such a relief. And so I'll do that for them here. But it's also a really available tool. So I'll also just teach you how to do it at home so that if something happens between our visits and you're really uncomfortable, you know kind of how to help yourself with that as well. So
How long does the treatment normally take? Because, like you were saying,
Mhm.
like, is it to the point where, like, if you have a problem like this, that you have to go forever, or does it become like where you can eventually do it on your own and you check in? What does that look like?
So it of course varies depending on kind of the severity and how long you've had it. So I would say probably the three most common like groups of people I see is like your typical postpartum person who's just like, I'm leaking, I want to get better. If you didn't have any significant issues before becoming pregnant, a lot of times and you didn't have especially traumatic birth experience, a lot of times that's not very many visits. It's usually like 3 to 6 visits, a lot of education, giving you tools to work on your own. And then usually I'm just kind of like, come back when you want to have another baby and we'll make sure that this stuff doesn't happen again. Or you're pregnant again. And then for like my more chronic people, a lot of times those people will see you a little bit in the beginning. And then depending on kind of how well you progress and what you're willing and able to do on your own time, a lot of my more chronic pain type patients, will get to a point where I'm seeing them maybe once every 4 to 6 weeks for kind of like maintenance. Because it's just a lot of life stuff that tends to build up with those people. A lot of times I'm referring them out for dietary assistance. A lot of times I'm referring them out for mental health. So once we get kind of the pain under control and get some tools in your tool belt for that, it's not that often. Most frequently, I see people once a week for an hour. But typically it's more like once every other week, once every few weeks. And then really just until you feel like you can do everything you want to do pain-free. And like with pleasure, like your body should feel good again by the time we're done, not like you can just survive. So, and then I would say besides that, I also have my like athletes. So they're trying to get to a more peak performance, and depending on kind of where they come in with that and whether they're trying to get to, that varies significantly. So I can't really give you a time for that,
but it doesn't sound like you're saying it's like when you have one of these issues, you're supposed to go like every single week your whole entire life forever.
Not at all, not ever. Especially and most people feel like it's going to be a lot, but so many of the behavior changes we are asking for is literally like drink more water. And people really have trouble swallowing that pill. Like they think that's going to be so hard, but I'm going to teach you how to do that. Like I'm going to teach you how to be successful with that. And once you get it, it just changes everything so much more quickly than people expect it to. So typically, no, I have very few patients that I've seen for over 6 months, over a year.
Okay.
Those are the bad ones. The bad ones.
Okay. So pretty doable. And then like, what would happen if people like never got treatment for these things? You could take one of the conditions or all of them. Like how would it like eventually manifest?
The tough thing about all this stuff is one, people usually don't like know where to turn if they even do know that they have it. So a lot of people I see have had issues for years and years and years and years. So in that case, it tends to just continue to get worse. But on the flip side, a lot of these things are not life threatening. So that's the other reason people don't always get treatment is because when they don't know where or how, and then they're also like, well, I can just survive. So I would say what we see most commonly is that your quality of life just continues to decrease. Like you are tied to the restroom, like you're that person that every time you go out with friends, you have to know where the closest bathroom is. Or you just kind of stop going places and eating out with your friends because no matter what you eat, you have pain anyway. Or, with like sexual function, it can tend to start to affect your relationships and things like that too. So the good news is most of these things are not life threatening. You're not going to die from not getting pelvic PT, but it is kind of quite sad that a lot of times people who don't get this resource when they really, really need it, they really do kind of continue to suffer. Most of these things aren't going to go away on their own, unfortunately, because the pelvic floor, really the whole body, but particularly the pelvic floor is so resilient that once it's really telling you that something is wrong, it usually doesn't just kind of like go away on its own. Or if one thing goes away, just like anything else with the body, it usually kind of pops up somewhere else because that's just a compensation. So I have a lot of people that'll be like, I was leaking, but then I stopped, but now I'm having pain with sex. It's like, well, the pelvic floor just tightened up to prevent the leaking, but now you're having pain with, sex, running, bowel movements, that sort of things. So sometimes it's like playing whack-a-mole because you just got to find every little problem and address it. But that's always like a big goal of mine is resolving your dysfunction to a point where it's going to go away and it's not going to come back. So not to scare anybody, but
No, I think it's good. I just want people to know that, like, if they're having these issues, it's like you said, it's not like life threatening. I think it's something that's so easy just forget about because it may not affect you all day long when you're working, but it's like can be worked on. It sounds like maybe relatively easily. Like it's not like you have to have surgery or anything
Mhm.
like that. There is an
Oh
option.
yeah, we save tons of people from getting surgery because a lot of people just, even doctors, a lot of them, public health is kind of new-ish compared to a
Okay.
lot of the rest of medicine. So a lot of doctors, particularly doctors who have been in practice for a long time, they don't even really know that like pelvic PTs are trained to like make it to where you probably don't need to get your diastasis recti and your abdomen surgically repaired, or we can
Mm,
help reduce the severity and the symptoms with a prolapse and all of that sort of stuff. So, and with that, like time and money, like a few visits to a PT is way more doable than surgery 99% of the time. And if you do come in our doors and you need surgery, we're gonna tell you that and affirm that
mhm.
decision and support you through that too. But I've had so many people come in that they're like, yeah, I'm really considering surgery. And I'm like, let's just give it a few months and see what happens. And then they're so relieved because they don't have to go through that.
Oh, okay, gotcha. Is there anything that anybody can do to like prevent any of these things? I guess the first thing that comes to mind, I guess, is like especially with like pregnancy, unless the other like the pain with sex and the like GI pain can also be somehow prevented like through the muscles.
Yeah. Yeah. So I would say the biggest tips to give everybody is lots of water. Drink plenty of water, especially if
Okay.
you're in Texas and it's over 100 degrees outside every day. Um, I really the as far as I get into dietary stuff with my patients before I refer them out, is like constipation is not normal
Mhm.
ever. Like it's very common, but it's not normal. So especially during pregnancy, always check with your provider. But a lot of women, pregnant or not pregnant, and men too, benefit from supplementing magnesium or just making sure they're getting magnesium in their diet.
Mhm.
That's going to affect your bowel movements and your muscular health a lot. So, a lot of us know our bones need calcium. And
Mhm.
I know you know this, but our muscles need magnesium.
Yep.
So, if we're working on getting our muscle function better, magnesium is a huge, huge help.
Mhm.
And then the way you breathe really matters. So a lot of us, like I grew up in dance and cheer and all that sort of stuff, and I learned to suck in my belly and like basically chest breathe because you're like in a leotard or you're in a uniform or whatever. And for our pelvic floor, breathing into our diaphragm and doing diaphragmatic breathing, not belly breathing, but diaphragmatic breathing helps our pelvic floor to relax for a lot of sciencey reasons.
Yeah.
So the way you breathe really, really matters, and holding your breath a lot tends to go along with pelvic floor dysfunction quite frequently too, and respiratory issues in general. So uh, the way you breathe, the way you poop and pee, and your nutrition really affect your pelvic floor.
That is so interesting. So I mean, it's pretty normal stuff. It's not like you're saying anything like you need to
Yeah,
go buy this crazy thing. Like it's just kind of like
no,
be normal.
please don't buy any Kegel machines. Please don't sit on those chairs that make your pelvic floor contract 1,000 times. Like, there's so many contraptions that are fancy and typically expensive that
Mm.
really just are not treating the body in a holistic way. So a lot of times they help things in the short term, but they can oftentimes make things worse in the long term.
Mm.
So it's kind of like everything else. It comes back to your stress, your sleep is a huge thing, your diet, and then moving. So a lot of us are, sitting a lot, and that's fine. But especially for our pelvic floor, which is what you're sitting on, you just don't really think about it that way.
Mhm.
We need to have good like lower back and lumbar mobility and hip mobility too, and ankle mobility because that goes with hip mobility. For everything to just be able to move well. So exercising, yoga, all that stuff makes a huge, huge difference for your pelvic floor health. It's just all inclusive. The pelvic floor where it sits in the body is just like it is affected by and affects almost every system we have. So
Wow.
that's
Okay.
why this holistic approach, it's kind of easy because it's a lot of small things, but it's a lot of things.
Yeah, yeah. No, I think that's great because you're basically like talking about what I talk about all the time, which is we got to get more active. We got to get drinking more water. You got to sleep because I think people neglect how these like simple things all do work together in a complex way, but they seem very simple, but they all need to happen to kind of work together is what I try to explain to people that you can relieve
Exactly.
stress if we are a little bit more active and just take breaks. And then that can help you to have improved like GI things, which can help you to not stress so much
Mhm.
anyway. And all of it really needs to work together, which it sounds like you're saying too.
Yeah, exactly. We see a ton of patients who have like chronic low back pain too.
Mm.
And that's super common in America. And some of the best treatments for low back pain is like water, movement, stress management. A lot of times it's not your back that's actually hurting, it can be your pelvic floor referring up to your back. Sometimes it's just constipation can actually cause a pretty significant low back pain. So that is like a big thing that I turn people back to too, is because I'm always checking everything and they're like, oh yeah, I saw this low back pain, but I've always had that. I'm like, well, you've probably always had pelvic floor dysfunction. Not always, like not since the day you're born, but for a long, long time, you've had pelvic floor dysfunction too, because it
Gotcha.
manifests through all of those things kind of coming to a head. So
Oh, wow. I didn't realize that. Okay. And then tell us a little bit about your company. So, like, how do we, I guess, start with like, how would you find like a pelvic floor PT in general? Like, we both live in Fort Worth, so definitely we'll plug Genesis, but how would like anybody who's listening somewhere else, like, how would they go about finding one? And then we can talk about like what makes Genesis different.
pelvic health specialists, there's a ton of directories available. So the main one I kind of direct people to is pelvicguru.com. That's where
Okay.
pelvic health specialists, that's one of many where pelvic health specialists can go and kind of register where you are, who you are, what exactly you treat. And most of us do like free consult calls. So we do free 15-minute consult calls because a lot of people have a lot of very good questions. They're not sure if it's right for them or whatever. So I always recommend calling and just kind of figuring out if that place is the right fit for you. So you can find the closest one to you on that registry. And then unfortunately, pelvic PTs, there's not enough of us to
Mhm.
serve the entire American or worldwide population. So a lot of us do offer telehealth too. So we can treat across borders in Texas. And so I have patients from all over the country
Okay.
and I treat via telehealth too. And then a lot of other people do that as well. So, and then honestly, a lot of us are on Instagram and TikTok. So
Yeah.
you can find us there too. You can find all of the Genesis therapists on Instagram and kind of get to know our personalities too.
Yes, we definitely need to plug you here at the end because I think you're a great resource with all the stuff that you make. But and then yeah, so tell us about the company that you work for. Like what are the details behind that, or what do you think like makes you different compared to other practices?
Yeah. So one of the things I work at Genesis PT and Wellness, like I said, I'm in Fort Worth personally. One of the things I love about working here is that we do an hour and a half evaluation.
Mm,
So that's a lot of time to spend with like a doctorate educated medical professional. And we really just listen to your whole story and make your plan based on that. So I feel like that helps a ton because really from day one, we are typically actually getting to kind of the heart of the issue versus a lot of times other people are trying, this and that and different medicines and things like that. So it helps a lot to have that much time with our patients, which is something I love about working here. And then all of our follow ups are also an hour long. And we are a cash pay clinic. So we're just fee for service. You just pay using your HSA or your private funds. We don't take insurance.
mhm.
But what that allows us to do and why we like it is we can tailor your treatment to exactly what you need and want it to be. So, like I said, a lot of it is education, which is what mostly becomes life changing. Like a couple stretches usually never fixes anything.
Mhm.
So, we're going to teach you those things too. But a lot of it is really listening to you, really teaching you, and then physically, working out those kinks and things as well. And then it's all just flat fee too, which I just love for my brain. I don't have to do a ton of math. You come in, you pay for our time and expertise. We give you exactly what we think is going to benefit you most. And then you're done. So I like that a lot too. We have what a lot of people kind of refer to as an orthopelvic approach too. So while we are trained in pelvic health specialties, we're also trained in like treating athletes, other orthopedic approaches. We have some like PRI trained therapists, which if you're like a medical nerd, you might have heard of that. And so we just have a wide, broad range of like treatment options and philosophies that we employ. So it's not just kind of like, oh, this one thing doesn't work for you, we don't know how to help you. Like we are here to just keep digging until we get to the bottom of it. So, which is fun. I like it.
Yeah, awesome, awesome. Well, let's move on to our article review for the day. So I thought that was really interesting. I was gonna pick something else, but this article came up like everywhere, and I guess it just came out like 2 weeks ago.
Yes.
And it's an article from Vogue about Ilana Glazer, and I know her because I love Broad City, but I think she's done like other things since then. I think she's like super funny, and I hope she does a lot in life. But I didn't realize that she had, I guess, pelvic floor issues her whole life. It said that she was like ever since she was 4 years old, which is crazy. I definitely want to get your take on that and how, I mean, kind of basically what you were saying that it was just like never properly treated, that she was kind of passed around from doctor to doctor her whole life, and how she was able to finally work with a pelvic floor PT who was able to help her. And now she's pregnant, which is amazing.
Yeah.
Yeah, did you like have any initial thoughts on like what that like article said to you or what it spoke to what we already said or anything like that?
I love that it's, out there in such like a popular publication because that is literally the story of so many of my patients. Like one of the most rewarding and saddest things about my job is how many people I have in my office who are like, I have been struggling with this for 10, 15, 20 years, like since I was a child, and no one has ever told me any of this because it's
Mhm.
just really not out there. It's not super available, and that's getting better, obviously. But yeah, that's a super common story is like we checked, their gynecological health, their urinary health, everything came back normal. But until you go see a pelvic health specialist, pelvic PT, like no one really checks those muscles
Mhm.
or those joints where you check the muscles, the joints, the nerves, the fascia, like all of the things in the pelvis. And yeah, it makes a huge difference in just your life. It just made me sad because that's such a common story. And a lot of people start to think they're crazy and end up, on other medications that are great because they can help, but they're not going to resolve the problem. So,
Gotcha. If for somebody like her, like, if like you're bouncing around from person to person, is pelvic floor PTs, are they somebody that you like have to have a referral for? Isn't that like some things with like insurance, or is it like that's why
mhm.
your practice is helpful since it's cash based, you don't have to have a referral, or is that not a thing?
So it depends on the state that you're in. So
Okay.
most states now have direct access to physical therapy.
Mm.
However, even if you have direct access in your state, your insurance might not pay for it without a referral.
Oh.
And since not everyone is trained in how to do a pelvic floor screen, sometimes doctors will be like, oh, I don't think you need it because they are not necessarily doing a screen.
Mm,
So if that's your case, options are like if you're like, I've read about this, this is what I
yeah.
have. I found someone who I think can help me with this, and there's kind of some like barriers there. One option is cash pay because once you take insurance out of the mix, that's not going to be a problem.
Mhm.
If that's not an option for you, there are some good pelvic floor screens that you can just find on the internet and show to your doctor.
Oh,
Or one of my favorite options is to get a new doctor who actually listens to you and will
yeah.
write a referral. But that's not always available. So sometimes you really have to advocate for yourself and find a resource that's like, no, I think this is what I really have. I think this is who can really help me and kind of convince them. Which in Texas, we do have direct access and we do
Mhm.
need a physician to sign off on your plan of care. Um, but especially since we are cash pay, like everyone comes in for their evaluation, we send their plan of care off to their physician, and then everything is good from there. So there's like no barriers to getting in here. But I do have people message me on Instagram all the time and be like, "This is my situation. What do I do?" And that's usually what I recommend is like get a new doctor,
Yeah.
find a cash pay clinic, or you just have to advocate for yourself and maybe ask your public PT to help advocate for you too if you found one. So
Oh, okay. Okay. What about like what does it mean that she had issues since she was like 4? Like how do you have
yeah.
issues like that young or what does that look like?
Yeah, so obviously the situations that lead to that can really, really vary. I mean, kiddos are falling down all of the time. So
Mm.
sometimes when I'm interviewing my patients, they will remember like, oh yeah, I had this accident. I fell off a horse or I fell off, my like Barbie dream car, whatever it was.
Yeah.
And like I hurt myself to where I had pelvic pain, but then I got better and everything was fine. And so sometimes that's what happens. Sometimes kiddos do have developmental issues that will kind of resolve as they age.
Mm.
But the bladder and bowel stuff doesn't really get better because that's so behavioral. So you learn a compensatory like way to kind of get through your life. And then unfortunately, the way we were actually potty trained can really affect those sorts of things too. So if you are taught to push when you pee and poop, because that's what your parents did and that's what their parents did, every body is different. So your parents might not have those same issues, but you might too.
Oh.
And then particularly for like the urinary system, sometimes, definitely not always, but sometimes, especially if you have any history of abuse, even if it's not sexual, it can show up in that way because that's a system that's so affected by our nervous system. And so it can show up there, especially in kiddos, but not always. Sometimes it's like you had an infection that the infection resolved, but the tissues that were affected by the infection are still angry and haven't been relaxed. But yeah, a lot of times it starts pretty young and then it can kind of get worse and worse and worse as you get older too, which is sad.
Oh.
There are pediatric pelvic health specialists. They're kind of few and far between. We have one here at Genesis that she's completely remote, so she sees people from wherever. And she's kind of a potty training specialist. So she helps kiddos who are having pain or problems with all of that sort of stuff. So it can mean a lot of things. A lot of people with a history of like concussion or neck injuries will also have bladder problems. Um, so, because again, everything is connected, both of those things really, really affect your nervous system and they can really affect your bladder and your bowels too. So, finding a provider who's able to look at all the systems and pick it apart is pretty crucial to getting things like that figured out.
Oh, okay. Yeah, that is so interesting. I was gonna ask about what you were saying there. She talks about how that it's where she like held her anxiety and depression. I didn't really know what she
Mhm.
meant by that. And I feel like you were kind of touching on that. What does that mean? Like does your body like clench when like there when you have like these problems, or what does that mean?
Yeah, so I kind of touched on it earlier, like your mental health makes a huge difference. And then one thing we do a lot of times when we are stressed out is hold our breath. So that's a really common stress response.
Mm.
And like again, like I alluded to earlier, the way you breathe and how you breathe really affects your pelvic floor. So a lot of times when we are in kind of that fight or flight response, we also freeze. And so we will hold our breath, we'll hold tension in our pelvic floor. And we'll just kind of stop these unseen body parts from moving. And again, they're designed to operate in the background without a thought in the world. And so a lot of times we don't even know we're doing that until we have someone who is actually testing that and it's like, hey, like, are you stressed? I kind of joke with some of my patients that your pelvic floor is like better than a lie detector test. Because a lot of times once we get to know each other, I'll be working on their pelvic floor internally or externally. And if I will be chatting about something, if they're stressed about it, I can feel their pelvic floor tighten up significantly and I'll be like, oh, okay, let's go back. You want to talk about that?
Oh.
It responds to everything going in our life, internally and externally, emotionally, mentally, all that sort of stuff.
And then the last piece in there, they said that 1 in 3 women suffer from something like this. Like, do you feel like that's that common? I mean, I never know where they pull these stats from.
I feel like it depends, like obviously what you're limiting it to.
Mm,
So I'm assuming that probably includes women who have given birth.
yeah.
But I would say, I mean, I kind of always joke that like everyone needs a pelvic floor
Yeah, it
PT
sounds like you're
because,
saying that. It's like, if you've ever been
because
stressed out, you need to go to
I
pelvic
feel
floor.
like everyone's out. Yeah. No, I mean, there's just so many things in our culture, like we've been talking about, that are just normalized, like being constipated, peeing all the time, not like drinking any water, the way we eat is obviously not so good for our pelvic floor sometimes,
Mhm.
and stress is a huge one. So I mean, I personally had a lot of patients that start like in 2020, they were like, I had this pain a while ago. And then once COVID hit, I just came back because it's so stress related. Our whole lives just affect our pelvic floor. The good thing is though, like you really can learn how to resolve all of that stuff. So it's not like you're just trapped there forever.
Right.
So I tell people, you're not going to stop getting stressed out.
Right.
We just have to learn how to like be more resilient to those stressors so that it's not going to manifest in your body as like tension and pain that
Mhm.
you're not able to get rid of. Because a lot of times people just don't even know what's happening.
Right.
Historically, pelvic pain patients were literally thought to be crazy because it just go away and come back and it'll be on one side, then the other side, the front, the back. Like it's just complex.
Mhm.
Um, you're not crazy if you have pelvic pain and it doesn't seem like it follows a super obvious pattern and it feels like it comes and it goes. It's probably just really related to stress.
Gotcha.
And but that can still be treated and that can still be resolved. So but
Okay.
yeah, everybody needs a pelvic floor
Yeah. And
PT.
I love it. I wanna give you all the clients because I think that, like,
Yeah.
yeah, it's just something a lot of people don't think about.
Mhm.
But I think that concludes all the questions for today. I feel like I could go on and on, especially, like, with all the different
Yeah.
specialties and stuff, so we'll definitely have to have you back, but where
Yeah.
can people find you at? Because you make great content. I love watching it. So where can they
Thank
find
you.
you?
I personally am Dr. Corrie, the pelvic PT on Instagram and TikTok. My TikTok is basically just my Instagram though, so pick one or the other.
Yeah.
And then you can find me for treatment at genesisptandwellness.com.
Mhm.
You can call, text, or email us to set up an appointment. And then Genesis PT and Wellness also has its own Instagram account. And like I mentioned, all of us have like social media because we love connecting with patients and everything. So you can find all my colleagues through my Instagram page as well. And they're all amazing.
Awesome. Well, thank you so much for joining us today. I definitely learned a lot. I hope everybody learned a lot. I want to force everybody to listen to this so they know this topic. But thank you so much for joining us today, Corey.
Thank you for having me. It was a pleasure.
Thank you so much for listening to the Millennial Nutritionist Podcast. For daily weight loss tips and nutrition information, you can find us on Instagram at the.millennial.nutritionist and on TikTok at millennial.nutritionist. If you find this information helpful, please subscribe to the podcast and share it with a friend who needs encouragement on their health journey. See you in the next episode.